I've been talking with community members and hearing a lot of skepticism concerning the vaccines that have just been approved. And there's a lot of reference to historical events. And so I was wondering whether you could speak to that. Why are people skeptical, and what is it about the historical distrust that persons of color, and particularly of African heritage, have concerning vaccinations?
Well, people of African heritage have a great distrust of the health system in general. The health system is an institution, and we know that within our institutions, there's racism. And we've seen this from time immemorial. So we know one of the first incidents is the Tuskegee incident. That was in the 1940s all the way to the 70s. And to show you how relevant it is, my grandmother's hairstylist had a father who contracted neurosyphilis, and we're talking in the 70s and 80s. So in my generation, there are people who existed amongst me in Birmingham, Alabama, who were victims of this experiment. We also know that even before then, during slavery, Black and African heritage bodies were used in experiments. J. Marion Sims, who's known as the father of modern gynecology, did experiments on slave women who had sustained birth injuries in childbirth. And so those women were operated on without the benefit of anesthesia and any type of antibiotics or any type of privacy. So our bodies have been used and abused. That's why we have so much mistrust. And we can even go forward into the Army, in which the Army used Black military personnel in experiments to see the effects of mustard gas on skin. So we can go all the way through these historical events, and it's reason enough for us to give pause as to, do we trust anything coming out of the health system here in this nation?
So what would you say to those who right now are skeptical, because they do have reason to be? What are your thoughts about it? What would you say to them, really?
I would say that this vaccine is done in the light. We know that these other things that I alluded to beforehand were done in the dark. We had to bring them to the light. Even the Henrietta Lacks with the genome for cervical cancer and so forth, these all had to be uncovered. Once we knew that there was a SARS-CoV-19 virus, that basically a vaccine was being worked on. So this was not done in the dark. So that's the first reason we should at least have some reassurance that this is above board. Number two, we know that the trials were not done solely on people of color. They were done in a broad-based community and sampling pool of willing subjects. So, and it's also been touted by our politicians. So anytime you hear politicians willing to take something, then you can pretty much be sure that it's not under the cover of darkness in terms of being something bad for us. But the main reason we as African heritage people need to take the vaccine is simply what our former President Obama says: when white America catches a cold, Black America gets pneumonia. And so we know that because of our predisposition to pre-existing factors such as obesity, hypertension, cardiac disease, sickle cell, cancer, that we are more likely to not only contract COVID-19, but also to have more serious morbidities and, in fact, mortality. So just for our health, we need to consider seriously, in mass, taking this vaccine. The second reason we need to take the vaccine is basically because of income. We know that the majority of African heritage people are essential workers, whether it's in retail, whether it's in fast food restaurants, whether it is in healthcare as medical assistants and orderlies and so forth. We have to go to work. And so if we get the vaccine, we're more likely to be able to be employed consistently and healthy. We need the money. Black businesses are the most likely not to reopen because of the lack of income and being closed down. So the more quickly we can get up to snuff in terms of getting a vaccine and getting people with some form of herd immunity and vaccination, we can reopen our businesses safely. The third is education. Our children already have an educational gap. We are less likely to have access to the internet for homeschooling. We don't have tutors, and we have parents that aren't able to sit at home and oversee our children's homework. So we do need to get the vaccine so that our kids can go back to school. so that if they return home to multi-generational families, that they're not infecting the grandmothers and the great aunts and their parents who are in the home. Another reason we should get the vaccine is psychologically. Sitting around in fear, not knowing if you're going to be infected, if you're going to die, if someone that you love is going to be sick and affected, is damaging. So for our communities, we need to basically take the vaccine for our psychological well-being. And then lastly, which may not be as serious, but certainly can be a motivating factor for our younger African heritage people, get the vaccine so that you can return to your social life. I know you want to go to the clubs, you want to go to parties, you want to go to family gatherings, our churches, our cultural events. Getting the vaccine will get us back into a social milieu that will benefit everybody. So those are just a few of the reasons I think that we should seriously consider when it comes to getting the vaccine.
Absolutely. I like that you have just connected it to other like social determinants so that people know that health intersects so much with, every other area of our lives, the economy, education, and so on and so forth. I just have one last question for you. You are a healthcare provider. Will you be taking the vaccine?
I will absolutely get the vaccine. Not, I do have a pre-existing condition, but even if I didn't, I'm a healthcare worker. I have elderly relatives. I like to travel. And believe it or not, COVID has affected my ability to work. I can't do surgeries because their beds being taken up by COVID patients that otherwise would have been by healthy patients getting routine services. So this affects us all. I will absolutely unequivocally run. As soon as they tell me my vaccine is available, I will not only be there for the first dose, I will be there waiting for the second dose. And I don't like needles.
Thank you so much. I'm with you on that. I don't like needles either, but I will take it, when it's available.
A
Thank you
needle is
so
better
much.
than being intubated. And let me just tell you that it's a small price to pay to be able to walk around in relative assurance that you have some semblance of hope for health.
Thank you very much. Indeed, it's a small price to pay. Thank you so much.
You're welcome. Thank you.